Everybody has it, Dave will. A little spare tire they would like to deflate just a little bit, but carrying too much belly fat can have massive health problems as well. And this is where Naturopathic Dr. Joyce Johnson comes in. She's here with tips on busting the belly fat, changing the spare tire. Can it be done?
It can be done. It can be done. And you know what? We all tend to have a little bit of belly fat. And as we age, we tend to deposit more and more belly fat. It's kind of a sign of aging, the way that wrinkles are, because of how hormones are produced. So what we're talking about is not the belly fat that you can pinch.
Okay.
It's called visceral. This is deeper. So this is where your organs are in this fat, your aorta. So it affects how your organs are going to function.
Okay, so this is not just, we're not just talking about the unsightliness.
No, not just the muffin tops. We're talking about the deeper belly fat that makes everything kind of protrude.
Okay.
And it puts you at risk for heart disease and stroke and diabetes. And in order to check to see if you are at risk, the numbers that are sort of key for you: measure your waist. For a woman, you want to stay under 35 inches.
Okay.
And for a man, under 40 inches. Anything over this puts you at risk for the conditions I talked about in metabolic syndrome, right? So this is one of those risk factors.
And your waist?
Your waist is like your smallest part.
So
everyone's torso is different. So to say measure 6 inches, it just doesn't work the same for everybody.
But a little bit higher, not down here.
No, usually measure your smallest part.
Okay.
And also to think about, visceral belly fat is hormonally active. It produces hormones that stimulate insulin resistance, which then deposits more belly fat, which then produces hormones. So it's one of those, what came first, the chicken or the egg?
Okay, so there are various ways we can work with this specifically. Obviously, good diet, good exercise, that's all key, but are there specifics we should be aware of?
There are. So starting off with food, monounsaturated fatty acids help to stop belly fat before it starts. So good fats at every meal, so avocado, olive oil, those are good source. Pine nuts are great. They contain polyunsaturated fatty acids, which produce hormones that help to control appetite. So having like a shot glass full, like an ounce of pine nuts 20 minutes before a meal can help curb appetite.
Oh, no kidding.
And prevent overeating. The next food to focus on are low glycemic index foods. So foods that help to stabilize your blood sugar levels. If your blood sugar levels are stable, you're not going to be secreting insulin, exorbitantly throughout the day, right? So you're going to keep a nice stable blood sugar level. So high fiber, beans, lentils, whole grains, legumes, chickpeas, all of those sorts of things. Fiber supplements, PGX is a soluble fiber supplement that's great at helping to stabilize blood sugar levels. So this can be helpful in combating belly fat.
Okay, now moving on. I have this every morning.
Yes, so studies have shown that when you're deficient in calcium, it stimulates hormones to increase belly fat. So increasing calcium in your diet, low-fat dairy, Greek yogurt is a good way to increase calcium. Maybe it's a calcium supplement. Some women are taking calcium supplements, so that does help. The next is green tea. So studies have shown that drinking 2 to 4 cups of green tea per day target belly fat. And lastly, zinc. Believe it or not, we know zinc for your throat,
I only take it when I have a
men's
cold.
health, all those other sorts of conditions. But research followed obese children that were given a zinc supplement, no changes to diet, no changes to exercise, and they lost weight.
Wow, okay, that's huge.
Yeah.
Okay, and moving on.
Okay, so lastly, what I want to talk a little bit about is a hormone called adiponectin. And adiponectin, this is a hormone that's produced by your fat cells. It travels to your fat cells in order to shrink them, decrease inflammation, help decrease your risk factor for cardiovascular disease, and directly stimulate and target belly fat.
Okay.
So antioxidants help to stimulate adiponectin levels.
They're like a miracle fruit.
Half a cup of blueberries per day is beneficial. Turmeric, or curcumin, whatever you want to call it, tomato. This also stimulates adiponectin levels, which will target belly fat and decrease belly fat. Again, our monounsaturated fatty acids that we talked about earlier, the olive oil, avocados. And lastly, okay, so raspberry ketones and green coffee bean extract were on Dr. Oz a lot. Talked about a lot. So it's one of those things where you hear about it and you think, okay, I'm going to research this and see what is it doing. These two actually do stimulate adiponectin levels and specifically target belly fat. So that's sort of the supplement side of it. And lastly is exercise.
Do it.
And it's not just strength training.
Right.
So with decreasing belly fat, you want to increase cardiovascular exercise. 30 minutes of walking, increase that to 30 minutes of jogging when you are able to, and do interval training. that is key in helping to target belly fat.
Okay, this is all fantastic stuff. We'll make sure we put links to Dr. Joyce up on our website, breakfasttelevision.ca. Thank you so much for this.
Thank you for having me.
Really useful information.